Angie Settle, the CEO of West Virginia Health Right with Your Health Done Right, and I'm really excited today. We have Dr. Paul Legg, somebody that I've worked with for many years, and he happens to be West Virginia Health Right's 2023 Volunteer of the Year. This is a big honor. Once a year, we pick somebody for their contributions and their volunteerism at Health Right. He's also practicing orthopedic surgeon here in Charleston, West Virginia. And he gave me a little advice on a bone issue here or there, freebie here or there that I hit him up for, maybe or maybe not. But we're going to talk to him today, learn about his background and family, and just talk to him a little bit about volunteering. And then we might talk a little bit about all things bones. But thank you so much for coming on, Dr. Legg.
Well, thank you for having me.
Quite the honor. You have actually been on my list. I kind of have a running short list in my head of people that I think are really deserving of the Volunteer of the Year. And sometimes I'll have two. We sometimes try to alternate because we do a lot of dental care as well. We try to do a dentist maybe one year and then a surgeon or physician another year. But you're absolutely deserving. Tell me again, and our viewers, how long have you been coming to West Virginia Health Right? I know that's a hard question sometimes.
It is. It'd be hard to give you an exact number.
Yes.
I'm going to say approximately 15 years.
That's what I would have guessed. I remember when you started. So, when you came, I'm sure you didn't know exactly what to expect, but tell me when you came, and for our viewers, what did you find when you came there, and what made you come back?
Well, I started maybe a little unusual way. Mm-hmm. When I first came to town, which has been 27 years ago, mm-hmm. From the orthopedic standpoint, Health Right was well served, I thought. So several of my partners mm-hmm. served there, but one of the Health Right orthopedists was retiring. Mm-hmm. And he asked me if I would step in and take his spot.
Dr. Lukowski?
Dr. Santrock.
Oh, Dr. Santrock,
Dr.
yes.
Santrock. And I said, sure. So I'd be glad to. And when I got there, mm-hmm. the thing that struck me immediately, and that was part of why I continued, was that there was high quality. Good people to help mm-hmm. me when I was there, good facilities. And that was my initial thought mm-hmm. was, we can do good care here.
Well, I think too, I just want to touch on that, which is something that makes me proud, and that's why I've been there since 1997, is, a lot of people get an idea, free and charitable clinic, and they kind of get this idea, dark and dingy, and, desk bunnies in the corner, and just, broken equipment, and, second-rate stuff. Here, we're not charging for this, so here you go. Something I've always prided myself in, that I've aspired myself and my staff to, is to make sure it's the same quality of care that I would expect my mother, my sister, my grandmother, my children to get with regular commercial insurance if they would come to your office. And that's something we try to do, and I think that's maybe something that you picked up when we really try to give that high level of care and hold those same standards as a private practice.
And I think Health Right does that very well.
Thank you.
And that's what I noticed, again, immediately. When I thought about volunteering, to me, mm-hmm. volunteering really was two things for me. Some personal, because of my personal faith in yes. God. Service is one of those things.
Yes.
And then second's practical. So if I'm going to serve somewhere, I want to serve somewhere that you can do things and you can do them well.
Absolutely.
And Health Right, you can do things well.
I always tell people, my faith has a lot to do with my work. We're not a religious organization, but I kind of consider it like my mission field in West Virginia, because it's a lot of the stuff you people, Doctors Without Borders, and I know there's great work that's done, overseas, but for me, it's kind of like, exhibiting my faith in action in my own backyard.
Yes. Again, that's the personal mm-hmm. part of volunteering. But again, if you want to do it, mm-hmm. you want to be able to do it well. So my first visit there, mm-hmm. I asked for, hey, we're going to inject someone. it was ready. They had everything. We didn't have to look for it. They were very well prepared.
I think you can attribute a little bit of that to your predecessors, probably like Dr. Lukowski, who's now, I think, relocated to Myrtle Beach, maybe retired, and Dr. Santrock, because they trained us well to have that little orthopedic cart thing ready. So, and I've always tried to get with, with my staff, and hopefully that, you guys come, you're doing it out of the goodness of your heart. I mean, this is, highly trained surgeons, physicians that are given of their time totally free to donate care to people who are uninsured and lower income. And these are working people getting up every day, struggling, maybe working as a janitor or working at a gas station, and they're trying really hard to make ends meet. And, something catastrophic like, a knee replacement or some kind of injury, that can be a career-ending or a job-ending devastating thing. So what you do is you come in and you offer something like an injection or whatever, a consultation, or maybe they just need to rest, their joint or whatever, but then they're able to go back to work. And the alternative, which I try to always tell people when I'm talking in the legislature and different people or to funders, this keeps people in their jobs. Maybe they work 2 or 3 lower paying jobs. Maybe they don't have, a college education for whatever their best capability, where they're at in life and their upbringing. They're doing the best that they can. And what you do is so essential, because that person's able to get up every day, have pride, like we all do in West Virginia, go to work and keep doing what they're doing. And the alternative, if they had to pay that out of pocket, it's so disheartening for people sometimes that they have to get poor enough to qualify for things like Medicaid and not be able to work. So it's so great to have somebody like you that comes in to do something so essential, which, really helps keep people picked up and incentivize them to stay employed, which, we can go into how that impacts their mood and depression and all that kind of stuff. But that's so important. I want to thank you just while you're sitting here to tell you how important that is and how I've seen that over the years. And we'll have a volunteer dinner, of course, volunteer to your dinner to talk about you. And we have this great patient. I can share her name because she shared her story, Shirley Whittington, and who does that same thing and goes through the story of how much you've helped her and changed her life and kept things going. But people don't think about that, and that's pretty amazing. So what I've always told my staff, back to what you were talking about, I start preaching about health right, is always take care of your volunteers. Make sure that when they're there that you cater to them. Make it as easy as possible. Do everything you can, because you guys are coming in. You might have had a surgery, rescheduled or delayed or, whatever, and you're coming in to give of your time. And at least we can do is to be there smiling and have all your supplies ready. So we try to do that.
and that makes it go well. The other nice thing about being at Health Right is when you come there, I've had several people who've helped me on a regular basis. Right now I have Miss Ethel.
Miss Ethel, that's right. Miss Ethel, she's sweet little lady.
And the great thing about Miss Ethel is she knows many of the patients. So she can tell me more than the patient can tell me sometimes.
Absolutely, got that.
Which really helps.
Yeah.
That really makes it easier to treat that patient.
Yes.
But that's a thing that I noticed early was these were working people who didn't have insurance. Now, things have improved for those people, but still, even now, we have working people who don't have insurance.
Absolutely.
So it's very difficult for them to get any kind of health care.
Right.
What's great about Health Right is that if I need a study, I need an x-ray, we can get it.
And that's a great relationship, yes. So, we also celebrate Charleston Area Medical Center and how they've helped us over the years. We've been able to show through studies and different things that we're cost effective at Health Right. We encourage patients to come there instead of going to the emergency room when they can. Don't go to the emergency room for an earache, come to Health Right. We've helped decrease rehospitalization and readmission rates for people. It just makes common sense. If somebody's a diabetic and they go without their insulin, especially type 1 diabetics, they're probably going to end up in ICU at the hospital. That's going to be a major, major expensive, intensive care issue. If they can come to Health Right and we can provide them with their insulin and keep them healthy and safe, that cost is going to be avoided. So over the years, we've worked with them, and I've had a great relationship with Dave Ramsey, the CEO, president CEO. They write off, all the inpatient stays. If you decide you need to do a knee replacement on somebody and we take them to CMC, the cost is written off for the surgery, the cost is written off for anesthesia, the cost is written off for labs, everything tied to that. Of course, we do our due diligence at HealthRight to make sure that they financially qualify. We use a lot of drug programs for free medications. You get joints and even the medications you're injecting. So we have to make sure that they qualify. But CMC trusts that we do that. And if we do that, then they're willing to work with us. So that has always been a great, great partnership. That's how we do it. We do you doing your services and donating that. CMC donating their, the services and doing that. And you've got somebody, maybe out making $20,000 a year, doing their best, working 2 part-time jobs. That could be devastating, a $40,000, $50,000 surgery. It's probably worse than that now. I'm having hospital bills lately, but the fact that you write that up is amazing.
CMC really, from my standpoint, and now CMC Charleston Surgical, where we've also done things.
Absolutely.
They don't ask questions when we schedule these cases.
Right.
And my implant companies, DePuy and Arthrex, also have said, hey, if you're not charging and the hospital's not charging, then we're going to give you the implants.
Absolutely. So
they've worked with us too.
Well, and that's another step that you take. You're going out on a limb with these people that that you work with every day and say, hey, I'm here at HealthRight, I need you to donate that. So that's you advocating for the patients as well. And if you didn't do that, that'd be a missing step in the system. So that's important too. And I appreciate that as well, because that can be, like, again, life altering. When you've got somebody that gets a limb replacement, replacing arms now, hip joint or whatever, that can absolutely keep people employed, and that's important, even for the economy and tax base and all of that in West Virginia, for sure.
And many of these patients, probably most, don't need surgery. They just want to hear what's the problem, what can we do for it. And a lot of times they just want to know.
Yes.
Okay, I have some knee arthritis, or I have a shoulder tendonitis. Yeah, we could do something surgically, but you don't have to. Just knowing helps them say, okay, I can keep doing what I'm doing. I don't have to worry about that much right now. Maybe he gave me an injection, gave him some exercises. Right. And that just makes them feel good. They know. And
I agree.
They know, and then if they need more treatment, they come back and we give them more treatment.
Well, and we take, people that have insurance, you take, kind of forget. It's easy to call up and say, hey, I need an appointment. But for people that are uninsured, they can't do that. So sometimes the worst is just not knowing and feeling like that lack of control, that you're not seeing a specialist like you. Everybody wants to know what they're dealing with, and we're blessed to have somebody with a specialty like yours that's able to come in and do that. And reassurance, like, again, that you say that really makes a difference. And it's so important, people like you and the other people that volunteer, cardiology, endocrinology, everything, that come there and do that, and give that to our patients who otherwise would have no access. Again, they would be a lot of times going to the ER to see people that aren't trained in your specialty, and it's kind of a recurring cycle. A lot of people don't understand that, and we won't get into all this. My other soapbox is, the Affordable Care Act helped a lot of people, and expanded Medicaid helped a lot of people, but there's still a lot of people that are working poor, make too much for Medicaid. And when I say working poor, I mean that with love. They make too much for Medicaid, but when they look at, like, Marketplace, or they look at the insurance policies that are offered at their employer, it's too expensive, or it's catastrophic care, meaning, it'll kick in if you hit a $10,000 deductible, or you have, a $100 copay on medications. And when you have somebody working paycheck to paycheck that's struggling to pay electric and gas and, have provide and food, groceries don't even, let's get started. I got 8 kids, so let's not even go there about how expensive that is right now. But that kind of stuff is prohibitive. And I've heard so many stories about patients at that income level trying to stretch their insulin, or just going without care, going without blood pressure medicines because they just don't have it. So that, too, is kind of the new HealthRight patient. We still help, people that are super low income and those in Medicaid, services that aren't covered, but that just above that level. And I think that's what's so important about what you do, and what about HealthRight does, is we keep those people, well enough to work. Without Health Right, without people like you, they would have nothing. And again, it's an incentive to stop working and get poor enough to qualify for assistance. And I think that's just one of the biggest stories about us and about what you do, the 43,500 people that we serve, is how much lifting people up. And I always tell people we're like one of the only places that you ever go that we hope that you end up not needing our services. You know, it make me so happy. Somebody gets better, or somebody goes off to college, or they get a different job, or they're able to get, you know, well enough to where then they get some great benefits and they can go to your private practice or whatever. But that's just so important. That's why you do, you know, that.
And you also help people find benefits. From what I've learned, that sometimes we prepare for surgery, and Health Right's able to say, hey, you do qualify for this.
Right.
We can help. And those, they don't know how to look. They don't know how to find all the things that maybe they are, you know, able to get.
Right.
And Health Right helps them find those things.
That's something that we've made a commitment with CMC, with you guys, is if they haven't went through the Medicaid qualification process or whatever, that we do that and that we assist them, because, you know, we want to make sure if they qualify for these benefits and there is a pay source through whatever, that's connected. And a lot of times, you know, like I said, they don't have child care. You know, they don't know what office to go. They don't have a car. So telling somebody, you need to go to this office and fill this paper out, and you need to go to this office and do this, it just never happens. So that's kind of why we pride ourselves. I call it that one-stop shop, like a NASCAR pit stop, where they come there and they get everything, you know, so that we bring the care to them, because it's so hard. Sorry.
Yeah, no. So, well,
I get so excited I talk too much.
so many orthopedic surgeries are not just have your surgery and go. So these folks are going to have to be off work sometimes a little bit. They're going to need therapy. They're going to need medications after surgery. So it's not just simple of have your surgery and go. So they're going to need things, and, you know, Health Right still steps in to, you know, get the medications, get the therapy, all the things they need to recover from orthopedic surgery.
Yeah. So let me just do one little kind of tout us for just a second. If you happen to be watching this and you're a physician or surgeon and you think about volunteering, one other thing we want to talk, we try to make it painless as possible. We don't have all the results coming to your office and you're trying to figure out where their chart is and what's going on, all that stuff. Everything that you do when you're there comes back to Health Right. We do have mid-level nurse practitioners that kind of run teams at Health Right, where we get all that information back. A lot of times they may touch base with your staff or your office, say, hey, can this wait? You want to see them back? You know, where we're kind of filtering through that stuff. So it's not like you come there and you volunteer and we're calling you every day, all day for, you know, 4 weeks after that. It's really while you're there, and then we've learned how to work with you guys, what you want to know, what you don't want to know. Think about that athlete that we had, and then stuff come back, and I think he had a torn meniscus or something anyway, or a torn ACL, and I was actually blessed to have your text number, and I'm telling you, hey, this person's got this, and you're telling me what to do. So we try to make it as painless as possible so that when you're there, you're doing it, but when you're gone, we're not driving you crazy. And I think we've done a pretty good job trying to make that as painless as possible.
Well, it's easy to get the information, and some of that is because we're doing many of these tests through CAMC. I can access CAMC.
Absolutely.
That makes it easy.
Yes.
But yeah, it's not just joint replacement. Yeah, with ACL reconstruction, shoulder reconstructions, rotator cuff repairs. We do a lot of different things for these patients. So,
yes, you do.
You know, the other thing is that just to make it easier on the patients, you probably know this, maybe you don't, is that often, you know, I'll sneak them back into my office for the post-op visits. It's just much easier when I need to see them in a week, or they just come back to my office, and then eventually I'll see them again at Health Right down the road.
But that's part of your giving nature, because you're actually donating another visit there in the practice to do that. But I think it's great that just, you know, I knew talking to you, I knew what kind of heart that you had, but it's heartwarming to know why you come, and then it's worthwhile. But, you know, we want to thank you for everything that you do again and again. I can't tell you how many times that I've had patients come back and how life-changing it is. You think about something like, you know, painful knee, painful hip, and you're, you know, basically stuck living with that and the unknown, or if it's something that can be surgically corrected. And a lot, these people, they want to work. They want to get up every day. It makes them feel good that they're contributing, and that, you help them do that. And it's amazing. It's amazing what you do. It really is. While we're here and talking, we have a few minutes. Talk a little bit about all things bones. You touched on a few things. I think historically West Virginia is a hardworking state. A lot of people work in labor situations. More used to be miners and things like that. I know I hear back pain a lot as a complaint when people come to me. What do you see as some of the most common things that you treat in your practice? Probably some things we've talked about, but what do you commonly see at HealthRight or even in your private practice that seems to be like the most common complaints?
The most common thing I treat is probably arthritis. Okay. Why do you get it? Okay. why does someone get arthritis of their knee or their hip or their shoulder?
Right.
Some genetic, some wear and tear, some what you do every day. Sometimes it's injury associated, but that's the most common thing we see. Now, I do a lot of other things. I do a lot of arthroscopic reconstruction, sports medicine type things. That's also a big part of my practice. So I do a lot of joint replacement. But, what do you see? You see joint pain. Now, does everybody need a surgery with joint pain? No. Okay. We treat a lot of arthritis without surgery. Many things that we can do. I treat a lot of rotator cuff problems in the shoulder without surgery. But by and far, that's what you see. Now, especially as I've been in practice for 27 years, I see more arthritis because my practice ages with me.
Yes, I understand that.
So I've seen some of those patients for 20 plus years.
Yes.
And just like, I have some arthritis, so do they have it now. They didn't have it 20 years ago, and I was treating them because they broke something 25 years ago, but now they come in for other reasons.
Absolutely,
but
absolutely.
Unless you're in a what we call subspecialized orthopedic practice, which is not real common in West Virginia because of our just we don't have a big population. So most people are kind of general orthopedists, unless they're at the university in Morgantown. They have some subspecialists there, but most people are general orthopedists with a little bit of a niche. They do some certain things over and over, and that's what I do.
Curious. So, like at your office with your, I know you have your partner or whatever. Do you all kind of be like, oh, that's a knee, let's do that. Oh, that's an ankle, let's do. Oh no, that's a wrist, or you know what I mean?
Well, a little bit. We do a little bit of that. Let's say this. We both do a lot of the same things.
Right.
Okay? We both do hip replacements, knee replacements.
You're referring to Dr. Castle.
Dr. Jason Castle.
Yes.
I probably swing more hip replacements to him. He leaves more of the shoulder replacements and shoulder arthroscopy to me.
Right.
We both do lots of knee replacements. And what the numbers and the epidemiologists tell us is that those numbers are going to keep rising. Okay,
Absolutely.
There's going to be more and more people who need knee replacements, hip replacements, shoulder replacements. The number's not going down. The number's going up. And we actually have fewer orthopedists than we did when I came here 27 years ago.
Question, is that because the population's aging, life expectancy is longer? Is that tied to anything? Is it tied to the type of labor, or what do I think more people need joints?
Life expectancy. People want to be active, so things that another generation may have tolerated.
I got you.
Okay,
I understand.
said, yeah, my knee hurts. That's life. I got to accept my knee hurts. Well, now, no one's going to just say, yeah, I'm just going to let my knee hurt and I'm okay, and it'll affect my. No, you want something done.
Interaction.
And so, you want to give people a quality of life. And as we know, I think the Canadians, they've looked at these not only for how people perform, but they've looked at cost. So if you do a knee replacement or a hip replacement, does the benefit to society,
Right.
is it worth it? They would say yes, because those people continue to work, they continue to be active, which prevents, other things when you continue to be active. And
Right.
then,
True.
then, so so those are some operations that you can say, yeah, if you do this, it's going to benefit this patient. Not just their joint doesn't hurt
Right.
anymore, but they keep doing something. Again,
Well,
they
you
keep
think
working.
immobility, then you're more likely to have obesity, then more likely
Right.
to have diabetes, then more likely to have heart disease and all that kind of stuff, more likely to have depression. And then, of course, the cost of like chronic medicines to treat the condition that you didn't intervene for,
Correct.
like arthritic. That makes a lot of sense. It really does. It's kind of the same principles that I'm applying to, our uninsured patients, and why it's beneficial to help them because of the same thing. That's pretty good. I was curious about that though, because, have you seen a change at all in terms of the labor force? And have you seen any shift at all in West Virginia in terms of, is it less labor intensive, hands-on manual type issues? And are you seeing more things with like typing at a desk and stationary stuff or not?
Have not seen I would say a great switch in that so far. And it's hard to say, what are the manifestations of changing that job?
Right.
And can you still get those same things? You can get them no matter where you
Right.
work. And that's where the genetic component of what are we predisposed to? Okay,
Right.
what element are you going to get that's different than what
Right.
I'm going to get because of our
Right.
genetics? That we're nowhere close to solving that part of the problem.
Right.
I hear all the time people say, well, are you using stem cells? Well, not a lot right now, because in
Right.
orthopedics, it's very investigational. Okay, it's, there's going to be a place for it, but is that place 10 years down the road? Probably not. It's probably a little longer.
Right.
There's some very specific things, but they're narrow right now. So, I would like to say there's a lot of new problems, but there's not. I mean,
Right.
it's just
Same stuff.
people know now that, hey, they can be helped.
Right.
Okay. My knee hurts, my shoulder hurts, my hip hurts. At one time, you couldn't make it any better, but now, and we don't say that there's an absolute age where, hey, if you're younger than this, you can't have a surgery or a joint
Right.
replacement. We go on, is this affecting lifestyle? Is this affecting function? Is this affecting quality of life? And have you failed treatment? Then you're a candidate for a surgery.
Yeah, I think that we have a few seconds here, but that changes because, life expectancy's longer, things that used to kill people earlier, and all the accidents and things, you're thinking back when my grandparents were younger, and now people are living longer. So it's something, as we progress, we're still going to learn about it. And that's what keeps people excited in their professions, because you're always learning something new, and there's always new and different things changing. So that's great. Well, I want to thank you. We got about 15 seconds here. I want to thank you so much for coming on. I could talk to you for 2 more hours. I always learn something great and new when I talk to you, Dr. Legg. And again, I want to thank you for all that you've done for West Virginia Health Right and our patients. Thank you guys for joining us, and we'll see you next time.